Well, a very good morning to you. Yes, on the start of phase 2 of the vaccination program in South Africa. We're live from Linden at one of the retirement villages and frail care centres here where some of the vaccinations will be taking place. You'd know that Gauteng has indicated that it's targeting about 280 of the old age homes in the province, and that's where those 60 and above will get vaccinated here in Linden. Of course, this is part of the national program that will be taking place. You'd know that the Gauteng provincial government had also delegated many of its MECs throughout various parts of the province to go and monitor the situation. We know that at about 11:30 this morning, here at this particular centre, the MEC for Education, who forms part, of course, of the provincial executive, MEC Panyaza Lesufi, who is the education MEC, will be here to monitor the process. You'll see just here next to me some of the staff at this particular centre have already been trained in order to perform those vaccinations. We do understand that the vaccines have not yet arrived, but we're expecting that to take place during the course of this morning before that process gets underway. But let me get more on this. Zabeth is the General Manager of the Advanced Section. Thank you very much indeed, Zabeth, for joining us this morning. I understand that you're targeting about 360 individuals 60 and above to be vaccinated today. Talk us through the process of getting ready for today.
It has been quite an extensive process, and we have been working very closely with the Department of Health. They have requested us to send our staff for training, which we did, and there have been various information sessions. They've been on site, and this request, they also provided guidelines for us to set up the vaccination station. And I think, as you can see today, it's all very well prepared. We're just now waiting for the vaccines, and then it is all systems are going.
You have several centres around this particular area. How many of those 60 and above are you expecting to vaccinate? How many have registered? And of course, speak to us to that target of 360 today.
Yes, can I just correct that we are actually in Lyndhurst, yes. And Rand Aid operates 4 retirement villages, 2 frail care centres, as well as a substance abuse treatment centre. All in all, almost 1,400 residents. And yes, we were targeting 360 per day because we have 10 vaccinators. Unfortunately, things are going a little bit slow at the moment, but we will see how far we get. It's a learning curve for all of us.
And just speaking to those, of course, who you take care of here, is there a general excitement? I'm sure we'll speak to them, Desiree, a little bit later on, but a general sense of waiting for this moment to be vaccinated.
I think everybody is so relieved that the day has finally arrived. And we have had an excellent uptake of people registering. And of course, we've got a few people, due to medical reasons, hospitalization, etc., who are not able to take the vaccine currently. But apart from that, the uptake has been magnificent. And yes, we had a really difficult time last year with COVID during the first phase, so we look much forward to the protection that this will provide.
And exactly how were you affected by it? I think, everyone has their different stories to tell about, how those, in particular, you have to take care of the elderly. How were you affected by this global pandemic that continues?
In a residential setting, there's always a high risk of infection, and that is due to the close contact between staff and residents, especially residents who depend totally on staff for everything, all the activities of daily living. So yes, we had infections. We ran our own isolation centre, and we have a marvelous team of doctors and nurses here who set a regime in place, and we were very successful in overcoming it. But of course, we don't want to have a repeat of it. So therefore, it is very important to us that this process rolls out.
Zabeth, thank you very much for your time. We do appreciate it. Live here, Desiree, in Lyndhurst, just one of the retirement villages, frail care centres that will be starting that process, the second phase of the vaccination process in South Africa. The target of about 360, the facility says, might not really be reasonable today, but certainly they'll try their best to get as many vaccinated as possible. As you would know, that retirement villages, old age homes have been basically affected by COVID-19, having to manage some of the nurses and doctors and the close proximity that they would have to some of the patients. And a little bit later on, the patients, well, not the patients, but of course those to be vaccinated, will come through to this particular facility a little bit later on, and we'll get a chance to speak to them about what this moment in particular means for them. You know that, of course, South Africa's process, had been highly criticised in terms of the slowness of getting the vaccines to South Africa, and a general sense that given that some of the provinces, including where I am this morning in Gauteng, already hit by a third wave of infection, so the speed at which South Africa, of course, would need to carry out this process, this second phase, would be something that needs to be carried out with quite speed. So we'll monitor the situation here. We're expecting the MEC of Education, part of the executive of the Gauteng Premier, David Makura. He will monitor the situation at this particular facility, and I know that Gauteng had also expressed a massive concern, of course, about getting quite a number of vaccinators trained. There was an indication yesterday at the media briefing that was given by the Health Minister, Dr. Zweli Mkhize, where he was joined by several Directors General of Health Departments as well as MECs, indicating their state of readiness for the various provinces to start this process here today. But it certainly seems like where I am, it's all systems go. And if we have a chance, Desiree, to speak to you once again, I know that you're monitoring very closely developments in Pietermaritzburg, would certainly be able to give you those visuals of those 60 and above coming to be vaccinated here today, and get a word from them, as you would know, that some of them, of course, some of their family members who they've left at home may also have been affected by COVID-19. So a step in the right direction in terms of how fast that process will go. We'll certainly monitor that.
Chriselda, thank you so much for bringing us up to speed in terms of this development. Of course, we're all watching to see what happens, especially with those concerns about storage.